Check, check. 1 2 1 2. Mic check.
So let's say something I see with yeah, they're well, we have cameras so that's what we're trying to do. So that's what we're
bench? Yeah. We look at a bench and you push everything. Sorry? We let members push everything.
Yeah, no,
I lost one.
Everything you guys are saying between yourselves is coming through on the live.
I know.
Just know once we go live, everything's going to come through.
Thank you.
Governor who?
He's also doing pool for all the Spanish TV. Or...
Sorry.
Yeah, we got it.
I really want to ask about
About 60 seconds out.
Who's the official?
Anybody outside?
Is this the official camera over here?
something about.
Are you the official camera?
Yes.
Are you on time of day or just random time?
Let's see. 3 or 4.
We'll give you about 2, 3 more minutes. Make sure everybody has. I'll come check in with you.
15 or 4.
Yeah.
3 1.
Shoot.
In your hand.
No, I have another.
Oh.
Concerned about your... No, I do, yes. I do, yes.
Not that they would ever come up.
Good save.
I already tried. Zoom bomb, I got.
Only so much you could do.
That was what, yeah, no, mine.
Yeah, we can. It was up there for a second. We're thinking about making your blocks up there if you're going to try to sign for a little bit. Yes. So you know.
Don't walk away.
Yeah, don't walk away. I know. I mean, tell me it's time of day. Yeah.
I just want my phone.
Wait, it's not
How are we doing? Do we still need a few more minutes?
I'm good, Patrick. Thank you. Go for it.
Anyone else?
Jay, I have a question for the governor.
Hold the question. Have a second. 30 seconds out.
Yes. Please don't repeat the slideshow.
You just send it to us?
Is gonna make it even.
We do send it.
Orders.
Just beforehand.
Oh, you mean
Stipulate.
cancel the presentation?
Cancel the presentation, and actually send us the executive orders ahead of time?
Beforehand.
Oh my God, no, that would be a secret. Oh no.
Oh, you're on the mic.
The public understands.
Good afternoon, everyone. Thank you for being here. It's good to see everyone. I hope everybody had a happy Mother's Day and was able to celebrate the mothers in their life this past weekend. On my right is Dr. Kara Christ. She leads our Department of Health Services. On my left is Major General Mick McGuire. He leads the National Guard and the Department of Emergency Management as well. I can't see the screen up here if we can get that fixed. So I want to begin by just again saying thank you to Arizonans. There's been a lot of sacrifice over the last 2 months. There's been an incredible amount of common sense, good behavior, kindness, commitment, and I'm very grateful. I'm very grateful, and if you can remember, yesterday was May 11th. I don't know how many people remember where they were on March 11th. It might have been the last day of some normality that we had in the state of Arizona. That was the day that I declared the state of emergency. It was the day the World Health Organization declared a global pandemic. It was the day that President Trump restricted travel from Europe to the United States. School was still in session at that time. Restaurants were operating. Spring training was still going on. So a lot has happened in those 62 days. I want to take you through a timeline of what's transpired since our first case in January of 26 in Arizona. And really what you're going to hear over the next few minutes is where we've been, where we are, and then where we're going as a state. Our first case was January 26th. After that, we had the Emergency Operations Center stood up immediately by Dr. Christ. Our state lab was one of the first by the CDC to be certified for testing of COVID-19. And then that date of March 11th was the public health emergency. On that same date was our first executive order to address visitation to our nursing home facilities. And on March 15th, schools closed. After that, we had an executive order to address elective surgeries, and our National Guard stepped up to help fill our grocery store shelves. On the 24th, we halted evictions for Arizonans. On the 30th, we put forward the Stay Home, Stay Healthy, Stay Connected order was first issued, along with extended school closures. Along the way, we received major disaster declaration from Washington, D.C., and we halted evictions for small businesses and nonprofits on April 6th. Additional protections on April 7th for our nursing homes and restrictions for out-of-state travelers on the 7th. We stood up the St. Luke's site if necessary, received 100 additional ventilators for Navajo Nation. Grateful to Bobby Robbins for the antibody testing he's brought forward. And May 1st, we extended the Stay Home, Stay Healthy, Stay Connected order. So where are we today? Well, we're a long way from where we were on March 11th. The focus this entire time has been on lives, on saving lives, protecting lives, and slowing the spread. Today, we're going to talk about how we're going to continue to protect life going forward, and we're going to talk a bit about Arizonans' livelihoods as well. Our framework is going to remain the same. We have been calm and steady throughout this. We've taken urgent action when necessary to protect public health. I have focused on an Arizona approach for our state, not focused on what's being reported elsewhere, learning from what we're seeing elsewhere, but doing what's in the best interest of Arizona. That's resulted in some later timing and a lighter touch in placing restrictions on our economy. And all of our decision-making has been data-informed and in alignment with public health. And I want you to know going forward that it will continue to be. This is the White House gating criteria. This document is a public document. If you search Opening Up America Again, you can print this document for yourself or look at it on your browser. We're going to talk about symptoms, cases, and hospitals specific to Arizona. I want the hardworking people at the CDC, Dr. Robert Redfield, Anthony Fauci, Deborah Birx, to know how grateful we are to them for their coordination with us and our team, as well as Vice President Pence for hosting the weekly conference call, the cabinet secretaries, and about once a week or every other week the president will be on that call as well. Let's talk about Arizona's specific symptoms. And the way that you get into phase one is what you can demonstrate on a downward trajectory of influenza-like illnesses reported within a 14-day period and a downward trajectory of COVID-like syndromic cases reported within a 14-day period. The blue line represents COVID-like illness. The gold line represents influenza-like illness. If you look across the horizontal axis to the y-axis on the date that the stay home, stay healthy, stay connected order was issued, you can see a continuing downward trajectory in COVID-like illness and in influenza-like illness over the next 4 weeks. This is a dramatic difference from where we were, and this is the direction that we need. So we in Arizona meet the White House gating criteria for symptoms for phase one. Next are cases. To meet it for cases, you need a downward trajectory of documented cases within a 14-day period or a downward trajectory of positive tests as a percent of total tests within a 14-day period. These are our COVID-19 cases by day. Again, this is a lot of information, a lot of data. It doesn't show the trend necessary for the information to make a decision. This stage gate does provide an either or, and I think for a state like ours that wasn't hit first, that wasn't hit hardest, in a state that is now surging testing, with more testing, you are going to naturally see more cases. So what we want to measure is what percentage of those tests result in COVID-19. This shows you that factor. The blue represents our testing over the course of time, and you can see how it is steep over the last several weeks. That's due to the surge in testing. Where I'd like you to focus your eyes is on the gold line, that on 4 successive weeks has a smaller percentage of positive cases of COVID-19. That's what you need. That is a good trajectory. More people are being tested with a lower percentage testing positive for COVID-19. Arizona meets the White House gating criteria for cases with a downward trajectory of positive cases as a percent of total tests within a 14-day period. Now, hospitals. You need to be prepared to treat all patients without crisis care to meet the criteria. Many of you have seen these charts before. The gray line represents hospital capacity. The blue line represents inpatient beds that are in use. The gold line represents inpatient beds used for COVID-19 patients. If you have a takeaway here, it's that Arizona has hospital capacity and Arizona is prepared. Same with our intensive care unit hospitals. If you're dramatically sick, you need an ICU bed. We have capacity, and you can see no spike in COVID-19 cases. Arizona's prepared. Same with ventilators. We have a lot of ventilators, and a lot of ventilators available. If you get very sick, you need a ventilator. Arizona has capacity, and Arizona's prepared. In addition to hospital capacity, we have 1,405 healthcare providers with adequate PPE to resume elective surgeries today. We have 51 hospitals with a robust testing plan and at least 14-day supply of PPE, which is personal protective equipment. 36,209 antibody serology testing reported to ADHS, and we've had over 210 million pieces of additional PPE acquired since March 1st from the federal government. The takeaway here is Arizona is prepared if things were to turn for the worse. That's not the situation in Arizona today. Let's talk testing. Robust testing in place for at-risk healthcare workers, including emerging antibody testing and trace contacts of COVID-19 results. So this is the diagnostic test that tells you if you're sick today, along with the antibody testing that Dr. Bobby Robbins touched on that tells you if you had contracted COVID and since recovered. You can see the testing by day here. The surge began on April 27th. That's the vertical or y-axis line. You can see the surge in testing since then. This represents over 159,000 tests in the state of Arizona, and we were given an A+ for data quality by the COVID Tracking Project as well. Arizona meets the White House gating criteria for hospitals to put us safely and squarely into phase 1. So where we are today with the decisions that we've made so far and the decisions we'll announce today, and I know there's been concern out there on is it safe? What is the situation? This guidance is according, again, to the Centers for Disease Control and Prevention. It's in alignment with the Department of Health Services. And we also, mentioning again the date March 11th, we know so much more today about what's important and what to focus on. So many of the decisions that were made from March 11th forward were to disperse large group gatherings so that we could slow the spread of this disease. And I've gone through the litany of decisions that were made along the way. Today we have to focus on where there are those gatherings in what would be called congregate care. Those are the long-term care facilities, and I've spoken about my personal interest for our most vulnerable and the people that we care about the most that are in these facilities, and also our corrections facilities in Arizona. So we have a plan for this and a focus on this, and Dr. Christ is going to take us through it. Dr. Christ?
Thank you, Governor. So the first thing that we are initiating is we have been working on developing a plan to test all patients and staff at our long-term care facilities. Yesterday, the White House announced that they would like all of these facilities that are Medicare certified to be tested within the next 2 weeks. So our team has been working on that plan, and this has been our top priority since the day that We issued the public health declaration. We required symptom checks for staff and visitors through that executive order because we know that we want to keep those vulnerable individuals safe. There's been continued action as we've continued forward. We have halted visitation, but we still want them to be able to see their families, and we want their family members to be able to see them. So requiring electronic visitation so that there is that ability. We've also provided certainty for family members so that they can get the information about their loved ones that are in a long-term care facility. The goal of this next step is to increase testing for that vulnerable population within our Medicare certified skilled nursing facilities, and then enhancing the infection control recommendations. Next slide, Governor. So we're currently working with 147 long-term care facilities to test their residents and their staff. We are working with our local public health departments in order to be able to coordinate this. We also are partnering with labs like Sonora Quest and other partners to help collect and run those specimens. So we will be collecting specimens for all unknown or previously negative COVID-19 if they are already positive. We have those results. So we will be doing a PCR or a diagnostic on every resident, and we will be doing serology and PCR on the staff. We know that maximum capacity, there's a little over 16,000 licensed beds and 11,000 staff. They run at about 73% occupancy, so we'll be working with them to make sure that they get the test results, that we provide the technical assistance for infection control guidance as needed for each of these facilities, that we're able to procure and give them the personal protective equipment that they might need, and then assistance with staffing. In case we had staff that needed to spend time at home healing, we can provide the staff for them to be able to continue to care for those vulnerable residents. Next slide. The next group that we're working with is the Arizona Department of Corrections, Rehabilitation, and Reentry. We know that COVID-19 can be transmitted very easily in congregate care settings, so we are going to be looking to expand testing capacity for our inmates and our correctional officers. So currently, symptomatic correctional officers are tested for COVID-19 and have to be medically cleared to come back into the facility to work, and then they do test inmates with COVID-like symptoms. Moving forward, we'll be working with the University of Arizona to get antibody testing for all of the correctional officers. And then we will also be working with our correctional facilities to have epidemiologists go out and provide on-site technical assistance on infection control and to make sure that the CDC guidelines are being implemented and provide assistance where we can. Next slide. And Arizona has implemented a contact tracing or enhanced our contact tracing. So contact tracing is something that is standard practice in public health. We've been doing it in Arizona for decades, but we need to enhance and gain additional resources. Contact tracing allows us to rapidly trace the contacts of positive cases so that we can test those that may have been exposed if they develop symptoms, and we can get to them before they may expose others. It helps to contain those new infections and then prevent or slow the spread of COVID-19. It was included in the White House gating criteria as one of the core state preparedness activities. So last week we implemented an enhanced statewide contact tracing. Next slide. So our local health departments really are the experts, and they are the boots on the ground, and they do the contact tracing in Arizona. The statewide enhancement is really going to be to provide additional resources to our local health departments for when they need them. But how does contact tracing work? We've been getting asked a lot of questions about that. So when a positive case gets reported to the Department of Health Services or to the local public health department, a public health professional will reach out and they will conduct an interview with that individual to identify when they had symptoms, how long have they had symptoms, did they have any contacts, where do they work, who have they been in close contact with in their household, at work, in the community, and then did they seek health care. That way, we can identify who those contacts are, and we can educate the individual who is positive on how to prevent spreading it to others. Next slide. So then public health is going to reach out to those household contacts or those close contacts make recommendations on whether they should stay home, on whether they can go to work but wear a mask, physically distance. We let them know what to look for and what to do if they develop symptoms, and we continue to check up on them. And depending on their risk or what they tell us, that could be daily or that could be multiple times. If they do develop symptoms, we will arrange to get them tested and then work with those individuals. In addition to following up with their household contacts and their community contacts, if we know that they went to a healthcare institution like a hospital or a physician's office, we will reach out to those healthcare workers because we know that they are also high risk. And then we will identify any individuals that may have provided care or have worked with that individual while they were at the institution, and then we will make recommendations to those individuals as well as the facility in order to prevent any further transmission. And we do that for all of the contacts. Next slide. And one of the things that we are very proud of, we have been updating and listening to a lot of feedback about our data website. We, by the COVID tracking project, were given a grade A+ on our website, our data dashboard for Arizona. So we were very proud because we're one of a few states that received the A+. So.
Thank you very much, Dr. Christ. Appreciate that. So let's talk about what's next. Arizona is headed in the right direction. We have a downward trajectory of influenza and COVID-like illnesses in our state. We have a downward trajectory of positive tests. We're treating all patients without crisis care, and we are rapidly expanding testing availability with solid data around it, including antibody testing and contact tracing. So this is a green light to continue going forward on the way out of this pandemic. Now, this is not a green light to speed. This is a green light to proceed, and we're going to proceed with caution. The objective is that we return stronger as a state. That's what we want to focus on, and it was hard fought to get the wins that we've had to attain to come here. It was a great sacrifice. I want to thank everyone for their cooperation, their commitment and dedication, along with their patience. So our plan is to do it the Arizona way. We're learning from others, but we are focused 100% on our state. Our decisions have been gradual and phased in, and that will continue. I know there are some people that want to go from phase 1 to phase 3 immediately. We're not going to skip a phase. We are in phase 1 today. We're going to balance public health and prioritize public health, and we'll return stronger. We're going to increase testing to return in May while maintaining strong physical distancing. This idea of physical distancing is not going away. It's what has allowed us to get many of the victories that we've been able to claim in making different and better decisions to bring back our economy, and it's going to continue to be a focus. And we're going to phase in our return based on the recommendations of the CDC and health experts throughout May and June. That has been the guiding light to get us here, and it will continue to be. So today we get the chance to turn that dial a little bit more to the right to brighten Arizona's economy and to bring back some of the energy that was lost due to this pandemic. Services that are currently resuming in Arizona, elective surgeries came back May 1st. Retail shopping can open in full last Friday, May 8th. I know some owners and operators were concerned around the safety of opening up retail. Again, I want to point you to the White House gating criteria and where we are in phase 1. Which would say that we are safe to open retail, of course maintaining physical distancing and CDC guidelines. On May 8th, barbers and salons were able to reopen, And we know that our restaurants have gotten so good at takeout and delivery. Dine-in services were able to resume last night. I know many friends who took someone out for a Mother's Day dinner. They bragged about what they saw inside the restaurant in terms of the responsible behavior, the training, the sanitation. I want to I think we've got one of the best places in the country in which to eat and the variety. And I just want to thank these business owners, the service workers, and the customers for their participation and their leadership here. I hope that everyone, there's about 80+% of our state that has not lost their job, that has not had a decline in pay. I had a friend of mine who said that when he went to see his barber that he paid him for all the haircuts he wasn't able to get, or being overly generous with our service workers. This downturn has been especially hard on them. But I want to thank them for the example that they've set, and I want to share with you just one example in Arizona.
It's just such a short payout and get out the door, and you're not getting that like human to human connection that you do when you go out to eat and get to interact with people a little bit more. My name's Heather Zia. I'm the general manager of Original Chop Shop here in Old Town. Kind of just 2.0 what we do, setting timers every 30 minutes, wiping everything down that any guest can have contact with, so like door handles, our tea station, the countertops, pens, credit cards in between transactions, everything behind that the guests aren't seeing. So all of our employees are washing their hands, we're wiping down all of our stations and doing kind of like a complete sanitation back there as well.
Today, I'm able to give a date certain of Monday, May 11th. Dine-in services can reopen.
Oh my gosh, we're so excited to finally have people in the building. Being able to make that connection in-house is one of the more important parts that I think makes a business successful. So we're just excited to have people in the building so that they keep coming back for us. It's safe, and we're doing all that we can to protect them, and it's okay to like go out and enjoy a meal and get out of the house, because I think we're all stir crazy. Here at Chop Shop, we are feel good, healthy food, and we have all of these safety guidelines in place, and with everything that the CDC recommends and the governor as far as like safety and sanitation, we definitely want to be open and just completely open our dining rooms and be able to interact with people again, but we want to protect you at the same time. We crave that human interaction, and it's already weird wearing masks and not being able to see each other's facial expressions, so like know that we're smiling under our masks when you do come in. It's just going to be a different experience, but I think that it's a good one.
Thanks so much to Heather for her commitment to public safety and protecting her employees and taking care of her customers. And that's the real spirit that runs through every Arizona entrepreneur and business owner and service worker in our state. So we're grateful to you and wishing you all the success going forward. And we're going to be partnering with you in this protection of people and public health going forward as we return stronger. So let's talk about what's new today. Effective Wednesday, May 13th, tomorrow, gyms and pools can reopen by implementing the public health protections and CDC guidelines. And also, Major League sports. This includes Major League Baseball, the NBA, the NHL, the NFL, MLS, are all able to participate and play in the state of Arizona after May 15th. Of course, this would be with CDC guidelines and protecting public health. We have had discussions with leaders of some of these leagues, and they all know they are welcome to operate, play, and perform in the state of Arizona. Our Stay Home, Stay Healthy, Stay Connected order expires on May 15th, 2020. It was extended from April 30th because we took a posture of an abundance of caution to make certain that Arizona is headed in the right direction. We knew that we were prepared, and all you have to do is review the data that we've just discussed. Declining symptoms, declining percentage of positive tests, adequate hospital capacity, and expanded testing. So what's next? I want to say before we talk about what's next that I think everyone knows, because Arizonans demonstrate such good common sense, that this does not mean a return to normal. This is the next step forward on the way out of this pandemic. We cannot forget about who's most vulnerable. Those folks that are 65 years and older with an underlying health condition, they are still in that situation. And those are the people, just like Dr. Chris talked about, our plan to surge resources in that direction to make sure that that population, those people, are protected. So our new executive order will be a stay healthy, return smarter, return stronger. It replaces the stay home, stay healthy, stay connected order that will expire on Friday. This stay healthy, return smarter, return stronger one will focus on our vulnerable individuals. The best practice they can have is to stay at home. They should avoid returning to work where distancing is not practical, and every precaution should be taken. Also, I want to ask Arizonans who have been so good and cooperative about this physical distancing to please continue it. Social settings where appropriate distancing is not practical should be avoided. And of course, CDC guidelines continue to be followed. For businesses, there are policies on our website that you can put forward in accordance with federal, state, and local regulations. You know the drill. Social distancing, protective equipment, temperature checks where necessary, contact tracing, sanitation. Most of you are already doing this, or your employees are going to demand that you do that. And again, if people are sick, they shouldn't be going to work. For employers, if people are teleworking today, in phase 1 of the White House guidance, they would encourage you to continue to telework wherever possible. You can also return to work in phases. I conducted a conference call with business leaders around the state last week, and one of the business leaders called in and thought that this was a mandate to return. It is not a mandate. It is showing you where we are in terms of the White House gating, and that it is safe to do that, and you are more than welcome to return in phases. As a matter of fact, in phase 1, which is where Arizona is, you are encouraged to return in phases. Minimize non-essential travel and make special accommodation who personnel are members of a vulnerable population. The recap is, let's focus on vulnerable individuals. Follow the CDC guidance, which is what Arizona has done from the beginning. If you can telework, do telework. Physical distancing won't go away. Avoid large gatherings. To date, schools remain closed, and in-person visitations to nursing homes are still prohibited. I know that there is a need to have interaction with folks, and this is really with the surge in testing and the more information that we have around this. There will be more announcements on this in the future. Everybody knows their part on washing hands, not touching your face, covering your cough, and of course, as we've mentioned before, if you're sick, please stay home, and please guide your employees, if they're sick, to stay home. So we're going to return stronger as a state. We know about the displacement that's happened in our economy, the amount of Arizonans that were displaced from their job or had their pay reduced. We've had over 500,000 people apply for unemployment. Unemployment benefits paid in the last 5 weeks are over $619 million. There have been a crush of applications overwhelming the system, but dollars are moving out to individuals that need it. Pandemic unemployment assistance, this is benefits for individuals who otherwise wouldn't be eligible. Yesterday, roughly $350 million was distributed by week's end, up to 39 weeks of benefits to qualifying individuals, and payments will be retroactive to individuals that did not receive a payment or eligibility back to the week of February 2nd, 2020. These are dollars eligible for the additional $600 per week included in the CARES Act. I also want you to know that we have many employers who are hiring today. You can see the good companies on here: McKesson, Vanguard, U of A, Crayola, Daisy Bread, Valleywise, U-Haul, Pitney Bowes, Hickman Family Farms, Intel, Target, Amazon, Penske, Salvation Army, and more. Some great Arizona companies here. If you want more information, go to arizonatogether.org for additional details. With that, we're going to go to Major General Mick McGuire to get an update on PPE and the Navajo Nation, and then we'll open it up for questions. General McGuire.
Thanks, Governor. We continue to work with FEMA and our federal partners on the logistics and supply to get PPE into the state. We went active yesterday with the Battelle N95 decontamination system that will be operating for 109 statewide partners in Arizona. And additionally, on the Navajo Nation, we continue to work with an outpouring of resources from federal, state, local, and volunteer groups as we synchronize their efforts as they continue to work in their fight against COVID-19.
Thank you, General McGuire. And with that, we'll open it up for questions. Patrick?
Start with Howdy. Hi, Governor. Still waiting for you to wear a mask, but we'll talk about that separately. A couple of questions. Let's start with just two. The broad general question is, what makes you think that people, seeing the data, we had 20 new deaths reported today. We have a declining positive rate, but that's because we've taken the denominator and increased the test of people who are not symptomatic. What makes you think that anybody is willing now to go out and risk, even with the stay-at-home order being dissolved?
So, Howie, I'm not going to allow you to manipulate the metrics that have been presented by the Department of Health Services and the gating criteria that the Centers for Disease Control have put forward. We've been asking a lot of Arizonans for weeks and weeks, and they have sacrificed. And we've been presenting the data in real time as we have it so that people can make responsible decisions. And I have asked a lot of people in Arizona in terms of this sacrifice. And it is today, with the necessary information for phase one of the gating criteria, to turn that dial on the economy and say to people that are not in the vulnerable category that we are squarely in phase one, and if you choose, it is safe to go out. And I know many Arizonans have taken advantage of this. I know many Arizonans are concerned. That's why we've stayed so focused on the data that we're providing, with the priority being public health first and foremost. Now, I do hear much of what's being reported, and when people talk about an increase in cases in the state of Arizona, I want you to know we're also having an increase in testing. So when you have additional tests, you're going to have additional cases. But this virus has been widespread for some time. It's in all 15 counties. It's in all 50 states. It's in 184 countries around the world. The virus is not going away, but we know who is most vulnerable. We're surging resources and supplies and tests to those areas. and we're putting forward guidance so that businesses can reopen and there can be another step towards a somewhat normal life, and it is safe in which to do that.
Okay. Leave my math question for later, and I can talk to Dr. Christ about that. What makes you believe, given what people see on the evening news, what they see from the dashboard that Dr. Chris has, that even if you say 11:59 p.m. Friday night, they're going to say Saturday, well, of course, now I feel safe.
Well, I guess, Howie, I wouldn't address people to feel safe by what they see on the evening news, okay? I'm asking them that I would like them to feel safe by following the decisions that we've made over the course of time to protect public health, to ramp up what was necessary to disperse these large groups. The information that we have that shows the slow of the spread of this disease and how we as a state, working together on each problem in its turn, have solved it. It wasn't that long ago we were talking about PPE and we needed more of it. Now you see millions and hundreds of millions of items that's a lot of gowns and masks and gloves that have been surged to Arizona. Then we were talking about hospital capacity, and we've got that hospital capacity not only in our existing hospitals, but field hospitals if necessary. And today it doesn't look like they're necessary. But if that were to happen, we can turn on a dime with the Army Corps of Engineers and the National Guard and present that additional capacity. Ventilators, that was what was next, and now you're seeing it in terms of testing, with hundreds of thousands of tests happening, and now a focus away from not only healthcare workers and people that are on the front line, but the folks that are in our long-term care facilities and our correctional facilities. We're making responsible, gradual decisions along the way, and what an Arizonan decides to do is up to them. I just want them to have the responsible and accurate information in which to make that decision.
Okay, real quickly, Tom Betlock was at one of your press conferences a few weeks ago, said we're working things out. We find out today tens of thousands of people are not getting the full aid to which they're entitled. So weeks ago we were promised by Tom Betlock it's being fixed. So why are we still getting people who are not getting their aid?
What I would say on Department of Economic Security, and that was in the last few slides that I had there has been a complete crush on the system. Over 500,000 people in the state of Arizona have applied for these benefits. The system has been overwhelmed. We are making fixes along the way. We are surging servers and computer resources and new employees. All benefits will be transmitted to these people. We've had hundreds of millions of dollars that have been put out over the last several weeks, and anybody that hasn't yet received the benefit, the dollars are there. We just need the connection to your bank account or direct deposit.
We're going to go back here to Andrew from the Republic.
Governor, is it your sense then that the coronavirus has already peaked in Arizona? And if that's the case, what is your administration going to be doing to make sure it doesn't come back or monitor for spikes, and what happens if it does?
So what I would say from where I sit, Andrew, around the coronavirus, and has it peaked or not, well, I don't know. That's what we're doing, is preparing for the worst case scenario. I want to ask Dr. Christ, her thoughts are where we are on the coronavirus, and then I want to talk about what happens in the fall if and when it returns. Dr. Christ?
Thank you, Governor. So we continue to monitor the data, and we will continue to monitor the data as we get it. We do not know at this time if we have peaked or if we would have peaked based on the mitigation strategies. We do know that we did slow the spread, and we'll continue to monitor to see if we do get increased cases or what happens in the fall.
So we've made very difficult decisions from March 11th forward. They've been tough decisions, but I'm confident that they've been the right decisions. I hope that I'm not coming off in any way, shape, or form that I'm overconfident about these decisions. That's why I've heard the people that have said, go faster, get to phase one quicker. What I wanted to do, if I could be accused of being slower to protect public health, well, I'll stand guilty, accused of protecting public health. But we are squarely in phase 1 today. When you talk about the fall and what happens if this virus is to return, we're smarter today. We know much more. We know where the vulnerable populations are. We can surge not only testing and supplies to these people, but resources. And that's what we intend to do. And we know people that don't have an underlying health condition, that are under the age of 65. If they continue to practice the good habits that they've acquired around washing hands and hand sanitizers and covering their cough and physically distancing, that we should be able to operate in the fashion that we're beginning to operate going forward. That's the objective, and that's what I intend to do, if at all possible.
Governor, why do we even have a stay-at-home order in place until Friday? People can go out and do almost anything they want by Wednesday. Who is enforcing social distancing recommendations? Are the guidelines you're putting out here mandates or merely suggestions to follow if you want?
So I want to say first, thank you so much for everyone's cooperation around the stay home, stay healthy, stay connected order. Everyone knows the reason that order was put out there was to slow the spread of this virus, was to disperse large gatherings. And people in Arizona have been terrific, if not the best in the nation at doing this. And I am very grateful. We're able to let this order expire because it's the right thing to do in terms of public health and public safety. We do need people to continue to physically distance. We are in that phase 1. There's 2 phases beyond this from the White House criteria. This is a good news day. This is a step in the right direction, but we're going to continue to walk, not run. Like I said, this is a green light to continue going in the right direction. It's a green light to proceed. It's not a green light to speed.
So is anyone going to enforce the social distancing at some, we saw restaurants last night pretty packed already?
Well, I want to say to those restaurants, and I saw many pictures, had many pictures sent to me, our restaurant owners and entrepreneurs and service workers went above and beyond to not only enforce physical distancing, but to bring best practices and comfort and confidence to the customers. And I'm grateful. I think that nobody's better at it in the country than the entrepreneurs in Arizona.
So no one is enforcing the social distancing, though?
Yes, there is. Yes, they are.
Who?
They are.
Who?
You seem very optimistic, not so much overconfident in regards to moving ahead and moving towards the goal. I want to gauge that a little bit with schools because there's been conversation about whether you go back, will you not go back, will that continue. There's a lot of data still to go and a lot of conversation to be had. But right now, how do you feel if this is the path you're on about schools opening in-person learning in the fall?
So thank you, Matt. I think it's a great question around our schools. I'd like to begin by just saying thank you so much to our teachers who've embraced distance learning. You've probably seen some of the videos that are out there on how they're keeping kids engaged in front of these screens. I know it's also a lot more work for mom and dad at home, and they have to help fill in the gaps and keep the attention spans there. From where I sit, I want kids back in school. I think parents want kids back in school. We want to do it when it's safe to do so. We're going to finish up this school year distance learning, and we only have a few more days or weeks left in the school year. We'll know more, though, as the weeks unfold over the summer. I'm going to defer to public health. I'm going to work in coordination with Superintendent of Public Instruction, Kathy Hoffman, who's been a real leader and partner in not only protecting our kids and teachers, but making sure that they have the resources necessary in which to complete the school year. I think we can all see, anybody who's a parent here, that it's distance learning is not the same as in-classroom learning. And many of our kids, depending on their situation, and the kids that are already our most vulnerable, the kids that are in the free and reduced lunch situation or don't have a parent who can stay at home or two parents or access to a reliable screen, well, they've lost more ground. So we'll have more work to make up. We'll put the resources and the people behind catching these kids up. But if it's safe and it's possible and it's in alignment with public health, I want to see our kids in school, and I want to see our teachers back in the front of the classroom doing what they do best, and that's bringing the best out of our kids.
Just a quick follow-up. There's an element to the economy that's tied with this too, in a sense of if parents don't have kids in school, it's hard for them to go back to work in some sense. How much are you thinking of that? And obviously the science is going to determine that, but what kind of plans are you preparing for as you anticipate that as we go through a typical summer in some sense with parents and kids at home together, but maybe not so much?
So I hope that everyone can hear the great questions that you're asking, because there are not only the idea of kids back in school, but of course parents going to work. The thing about the stay home directive was that parents were at home quarantining or working from home with their children. So as the weeks unfold, we'll have more visibility as to what's going to happen in K-12 education. And I think I've heard our university presidents say that they'd like to see college students back in the classroom. And this is something that was contemplated by our federal government in terms of the packages that were put forward and the amount of weeks that are there. Of course, everything runs out at some point in time, but we would have some flexibility as we head into August, September, and October of next year. So that part of it for parents and benefits, if necessary, if needed, that's been contemplated, of course.
Thank you. Let's talk about the folks who look at your green light like it really is a green light, and we saw some of them at this bar called Casa in Tempe. Maybe you saw that photo as well yesterday. Last time you memorably said, don't play with your liquor license. You warned people like that. So this gets back to the enforcement question. They seem to be playing with their liquor license. It looked like a party over there. So A, what should the police do? B, would you advise looking at their liquor license? And C, they apparently are immune from liability. Is that right?
Well, I want to say first, I think that if we were going to celebrate today, we should celebrate all the responsible business owners who did a fantastic job last night in reopening their business with a real care for their employees and their customers. If anybody's upset with the outliers, and there's always outliers, and they always seem to be the focus of settings like this, it's the responsible business owners that are not only allowing us to return safer and stronger, they've been smarter about it. You know, we made the tough decisions that we made post-March 11 because we wanted to protect people, because we wanted to slow the spread of this disease. And people said, we'll step up, and not only will we be smart, we'll be selfless in doing that. I'd like to ask everyone to do that going forward.
But getting back to who's enforcing this, that behavior is certainly not what you want, based on what we've heard here. What should the police do about that?
They've already done it.
What have they done?
You can reach out to the
We have.
authorities.
They've done nothing.
Well, that's not. Then you better check your reporting.
We're going to go to the Zoom board up here. We have a question from KJZZ. Katie Davis Young, go ahead.
Hi there. I'm wondering about the testing blitz weekends. It looks as though the testing blitz has not met the 10,000 to 20,000 test goal for the last few weekends. So what are you going to do to get more Arizonans tested?
Thank you, Katie. You want to talk about the testing blitz, Doctor?
Sure. We've been very pleased with the results of the testing blitz. On that very first Saturday of May 2nd, we collected 5,400, which you're right, was short of our 10,000 in one day goal. However, we were very pleased with the significant increase of tests throughout the week. So that very first week after we announced the Arizona testing blitz, we had 20,000 PCRs reported that week, and this past week we've had over 30,000 PCRs. Before that, we're averaging about 11,000 or 12,000 a week. So this has been successful. The first week we had about 33 providers participate. This past weekend we had 52 sites participating, and we still have providers contacting us to participate for this last final Saturday.
And I also want to say on our testing framework is there's a lot of folks that may want to brag on the number of tests that have been conducted. What we have done is prioritized our test to the people that are on the front lines. We've talked about the doctors and nurses and emergency healthcare responders. We've talked about the people that are symptomatic. So when you see our numbers that are ever improving, our tests have been reserved for those people first, the people that would have the highest degree of possibility of having contracted COVID-19. In this last 2 weekends, we've expanded that to people who think they've been exposed or may have been exposed. In some other states, what they're saying is, if you're in doubt, come get a test. Over the course of time, we will be able to open that up as well. What that would do is not give us an accurate reading on where we are in terms of contraction of COVID-19, and that's why our focus with future testing is going to be inside these long-term care facilities and our prison population. Thank you.
We have a question back here. Go ahead.
Actually, also on enforcement, I was just wondering if the state would consider enforcing, have some kind of enforcing, task force, or if you're just leaving it up to like the local jurisdictions.
So when we put out an executive order, to date, we have been able to have a statewide directive. There's a couple of reasons we've been able to do it, because first and foremost, the data supports a statewide directive. And sometimes when you do things county by county, there can be confusion. We've done our best to avoid that. And what the statewide order does is allows whatever local authorities are there to hold it up. And I'm grateful for the folks that have done that.
Yeah, just again with the enforcement, you said that Tempe PD had looked into this, and in fact they did, but no citations were issued because they looked inside that restaurant. But clearly, from the pictures we saw outside, there were a large crowd of people not practicing social distancing. From what you saw, should that have been allowed? And are you okay with this happening now that restaurants are opening up?
I would say I want to thank Tempe Police Department. I want to thank all of our men and women that wear the badge and protect us. And I'm grateful to them that they have taken the posture of having a lighter touch, of educating and communicating with people. And what they've told me is that most people respond. Most people listen. And part of this is education. This is a real change. I mean, the item that everyone is focusing on here from the press is not the good things that happened all over our state last night, but some things that happened in a college town on the day of virtual graduation. And the Tempe police went there, and the issue was resolved without incident. I'm proud of the police, and I'm proud of the people that made the right decision.
How do you stop that from happening as we move on in this? But large crowds of people, should they have been allowed to continue to congregate outside that restaurant, or should PD have stepped in from what you said?
So, Dennis, I think you ask a good question, is how do we continue to do this? I would say, how have we done this so far? We've done it by people exhibiting responsible behavior. Somebody on my senior staff brought up an example of that there's no national law or mandate around recycling in this country. The recycling that's taken place over the last several decades has been a result of positive peer pressure. neighbor to neighbor. In my case, it would be wife to husband, saying this is what we should do, this is what we should participate in. And listen, I don't like it any better than anybody else calling my grandmother on a speakerphone on Mother's Day so that we can all wish her happy Mother's Day. I want to be with her and my mom next Mother's Day, but we did it because it was the right thing to do, because of the category that they fell into and the CDC guidelines. And I think this idea of physical distancing, of people communicating with each other, that positive peer pressure, I will tell you, there's a lot of folks that said to the people that were making bad decisions that you're being irresponsible, you're not being smart, you're being selfish. And by and large, Arizonans have been smart and they've been selfless, and that's the spirit we have in this state.
Listening to this right now, we're going to hear you say, like, you're glad they took a light touch, so why would any business take what you're saying seriously?
Because I want people to, well, one, businesses are taking it seriously, and so are our citizens.
We're going to go to the Zoom board next. Jeremy Duda with the Arizona Mirror. Jeremy, go ahead.
Governor, we've heard a lot about some of the more positive numbers, flu and COVID-like illnesses being reported, a percentage of positive tests. But we've still got some numbers that are not looking, nearly as good. Total hospitalizations day by day are still very high. Death numbers are still pretty high. How concerned are you about these, and how are these numbers guiding your actions?
Thank you, Jeremy. I guess I would direct you to the slide deck that we just went through. Our hospitalizations are steady, if not flat. Same with COVID-19 hospitalizations. So that's not what the state's data is reflecting. And listen, we're going to mourn every death in this state. We're going to do everything we can do so that we don't lose another individual to COVID-19. We also know that so many of the people that we are losing are in this vulnerable category and at high risk with multiple symptoms oftentimes and over the age of 65. So we want to avoid and prevent every death possible, but the numbers that you're referring to, they may be happening in other states. They're not happening in the state of Arizona.
We'll come over here.
Today, when it comes to long-term care facilities, this question is to both of you, Governor, and Dr. Christ. We've heard that this is a high priority, that, quote, let's focus on our vulnerable individuals. But you guys won't release the data or the locations. We're only now starting widespread testing. For years, Arizona has ignored complaints, thousands of complaints from long-term care facilities, where those people, those residents, those families, they were ignored. So why should they trust that you actually are prioritizing them at all, given the fact that they've been ignored for so long?
First, Dave, I've got to correct some of the misstatements that you said into the microphones. Our first executive order was on our long-term care facilities on March 11th, the day we declared the state of emergency. We have escalated guidance into our long-term care facilities, and now we are going to be surging testing into our long-term care facilities. This is where our vulnerable population is living. This is the focus. We're talking about what's happening around COVID-19. That's where our efforts are today. If you want to focus on issues that happened before then, we can do that at another press conference. We're talking about the public health emergency and the pandemic that's in front of us. Dr. Christ, will you talk about the other things that are coming for our long-term care facilities and congregate care?
Sure. So public health does go and help facilities that might have positive COVID cases and work to provide infection control recommendations, technical assistance, and will continue to do that as we expand testing in our long-term care populations.
So you want us to trust you that going forward you'll do things well when thousands of complaints about health and safety were ignored for years. Your state auditor determined that. I'm not making that up. That's truth. That happened. Why should they trust you?
Dave, we're putting forward the facts of what's happening inside our long-term. Can I go? Can I answer,
I want
please?
you to answer
Can I answer the question, please? You know my grandmother lives in one of these facilities, Dave?
We're one of the thousands.
You know she lives in one of these facilities?
People's lives
We're
are
going
on
to
the line
put,
right now.
okay. Dave, if you've got a speech to give, we'll let you give it. If I can answer the question, I let you ask your question, and I showed you respect.
You didn't answer the question. That's not respect.
Listen,
the question and the people in those facilities.
Dave, you get to ask the questions. I get to answer the questions. We're putting every resource possible towards long-term care facilities. It was the first executive order. This is the toolkit on state actions to mitigate COVID-19 from across the country. Arizona's among the leaders in what we're doing, and we have a plan to do even better. That's what you're going to see going forward inside of Arizona.
We're not releasing any data like other states are.
And I've got to correct that as well. That's just not true. If you have someone that's in a long-term care facility and COVID-19 is contracted in there, you will be contacted immediately. If your loved one is in one of our long-term care facilities and you are the next of kin and they contract COVID-19, you will be contacted immediately. And if you are putting a loved one in one of these long-term care facilities, once they are approved for acceptance, you will be notified immediately about the COVID-19 situation inside that facility. You should have your facts straight.
Other states are releasing the data, and the feds are going to release it too.
No way. Get some other outlets in here, please. We're going to go to J.J. Cooper with the AP. J.J., go ahead.
Governor, you mentioned sports during your presentation earlier. You told us a few weeks ago that you had conversations with the commissioner of Major League Baseball. I think I heard you mention that you had conversations with others. Can you tell us what you have in mind for sports? Which leagues you're in conversation with, and then also I assume you mean without fans, if there's any activity.
Yes, thank you. Thanks very much, Jonathan. I have talked with the commissioner of Major League Baseball. He knows that baseball, of course, is welcome and loved in the state of Arizona. We are the home of spring training for Major League Baseball, and we'd be more than happy to host the season. I also would love to see an NBA champion crowned this year. I'd love to see a Stanley Cup presented. And, of course, we want to see the Cardinals kick off and all the new draft picks dominate the NFC East. So we're open-minded to each of these things. It would be at this point in time, according to the CDC guidelines, without fans. But according to Dr. Chris, from a public health perspective, we could do that safely in the state of Arizona beginning May 16th.
We're going to KTAR, please, Peter.
Thank you. Dr. Chris, for you. Does the dashboard data listed under number of cases reflect positive tests just for the virus, or does it also include positive antibody tests? We're trying to differentiate if there's an exact raw number and not just a percentage.
So I'm sorry, I don't understand the question. Are you asking about the cases or the tests?
This one's on cases, listed under number of cases. It might be a complicated question. Maybe we can resolve it.
Maybe some clarification on the dashboard summary. You indicate new cases reported today. First, is that a combination of both PCR cases and serology tests, or just PCRs? Secondly, on the more detailed testing actual page, at the bottom you include the percentage of the number of tests done, the percentage of positive, but you don't include an exact number of those individual serology and PCR tests. Why not put the actual number split out for each type of test?
Well, and I can take that back to the team. So going back to the cases, case is going to be a confirmed, yes, thank you. The case is going to be a confirmed case or a probable case, depending on the case definition. So that can include a PCR, which is a positive diagnostic test, or it can include a positive serology with somebody who is what we call epi-linked to a case. So if I'm a confirmed case, and I've had close contact with somebody and they have a positive serology, they could be considered a probable case. It could also be if they're showing symptoms consistent with. So it will contain both of those types of cases. And I'll take the data question back to the team. Absolutely. Thank you.
I do have a question on another topic.
I'm going to go over here. 15's got a lot of questions. Antonia, go ahead.
All right, Governor. So
I'm going to bring this up again. It has to do with the enforcement. Fact is, over the weekend, just reporting on these like local businesses selling Mother's Day flowers, they were full with people who've seen that restaurant whose photo has been going viral. You know, just looking at it from like the point of view of what appears to be a huge part of Arizona communities, people are taking social distancing very loosely. I think that's the word I want to use. I don't know, not taking it as seriously as we probably should. So as a leader of our state, how much enforcement should we really have with these kinds of issues?
Well, Antonia, I would say that Arizonans have taken physical distancing very seriously. That's been the observation over the last 8 weeks. We would simply not have the success in the downward trajectory of COVID-like and influenza-like illnesses that we have today. So you don't have to take my word for it. Take the medical data, okay, as evidence that this has worked and that Arizonans have taken this very seriously. Now, I've said several times that there's always going to be an outlier. There's always going to be someone who's more focused on themselves or not thinking through what's in the best interest of their neighbor. But that's not the majority of Arizonans. You're just taking an example and wanting to amplify it. And if someone does do that and law enforcement indicates to them that's the wrong thing to do and they say, okay, I'm not going to do it, well, I don't know what more you would like. That's what I'm asking, and that's what has been the response. And I'm not only grateful to law enforcement, I'm grateful to the people in Arizona for their attitude of wanting to help their neighbor and their friend.
Governor, I'm sorry. Your response to these protests that have been going on, a lot of people outside angry about Department of Corrections, inmates. What is your response to these protests?
Well, I'm not certain exactly what the folks outside are protesting. I mean, there's it could be any variety of things. What I would say to them is they maybe should listen to what was said in today's press conference about the focus of people not only in long-term care, but in any congregate facility, which includes our prisons, so that we will have ramped up testing, cohorting of sick patients, so that we can care for people and get them through this.
We want to wrap up. I'm going to go to Melissa and Dennis.
So we've been reporting on the last week about the scientific modelers, the modeling working group over the past week, and one of them put out their independent report over the weekend saying that they do think that if we reopen now and don't keep up with the social distancing, that we will overwhelm the hospitals. With all that in mind, you have not commented on what happened last week, Governor, when the team's work was paused and then restarted. Were you aware that their work was going to be paused before it happened?
I was not, and I would say to anyone that has an issue with the data that we're presenting, their issue would be with the Centers for Disease Control and Dr. Fauci, because that's the guidance that we're following. And if you want to talk about the decision last week.
Sure. Yeah, thanks, Melissa. So we are very pleased with our partnership with the universities. We were asking them to pause because they had volunteered their time. We knew that we wanted to bring them back to look at flu with COVID during the flu season. But when they said that they wanted to continue volunteering, we are happy to have them continue to do the work.
Dennis, go ahead.
Yeah, I just had one more question about the particularly restaurants, service, or industry businesses reopening this week. That is good that these workers are getting back on the job, but has there been any thought given to these folks if they do get COVID-19? Because a lot of them don't have health insurance. A lot of these restaurants, they do not provide health care insurance. Any thought about how to assist them moving forward?
Well, I again want to say just thanks to our business owners, our service employees for the good work that they're doing. Every day I'm concerned about the number of folks that had a great job or were at a a peak earning level and were then displaced and put on the unemployment line. And now the opportunity is for people to get back to work. So, of course, we want to make sure part of the reason we go through the data, the hospital capacity, the PPE, the ICU, the ventilators, is so that we can care for those that need it. We can care for those that get sick. I also think it's important to understand that this is a virus. And while we like the trajectory and it looks like maybe we're coming to the end of a season, the other things that we've talked about in terms of the fundamentals, the hand washing, covering your cough, all that's how people can avoid being sick.
Still, people might get sick, then they're going back to work, and they may not be able to afford if
And
they do
we
get really
have
sick.
the
And you thought
ability
about
to
the
care and comfort for them.
system
No
of
one
payments.
will be turned
The
away.
medical costs can be pretty outstanding for something like this.
Is there any clarity on what's happening with the dollar donation? Why we're still seeing cases very disproportionate to the size of the population in that part of the country?
So our focus, if we have had a hot spot in the state of Arizona, it has been on Navajo Nation. General McGuire commissioned 2 Black Hawk helicopters, 8 emergency medical personnel, PPE, resources. Again, thank you to President Trump and Senator McSally for the ventilators we were able to get to Navajo Nation. We do still have issues there. I believe we have our arms around the situation. But if you want to talk about where we are today in terms of what's happened in the last several days, I'll turn it over to General McGuire.
Thanks, Governor. So I was able to visit the alternate care site that we activated at Chinle in association with the IHS hospital there in the community of Chinle. There's a second one in Shiprock, as well as an alternate care site in Gallup, New Mexico. Those are currently staffed, and at least on the Arizona side in Chinle, there are no patients yet that have been needed to be moved out of the IHS facility in Chinle. In terms of the treatment that's been afforded at the 638 and IHS facilities, they've been able to either enter into contract or get additional staffing at each of the facilities, so that, as the governor mentioned, the hospital capacity is holding right now, and we do have surge capacity in these alternate care sites should it be needed. In terms of the course of the spread of the disease, we've seen it kind of rotate from the Tuba City area further to the east, so that now most of the concentration in area is over in the Shiprock along the Arizona-New Mexico border. And we're just continuing to manage and work with incident managers in the Navajo Nation and FEMA to try to mitigate the spread of the disease.
We've taken a lot of questions. We have time for one more. We're going to go to Rachel Leingang from the Arizona Republic via Zoom. Rachel, go ahead.
Governor, I don't think you've clearly answered the question on, I know you said that cases are increasing because testing is increasing. The percent positive rate would also go down if testing increases. So how is that measure meaningful in this scenario?
So, Rachel, I would want to address the math, just the simple arithmetic that you're bringing to this. If you do more tests, you're going to see more cases. When you see the percentage of positive cases, and a positive case means someone has contracted COVID-19, when you see that going down, that is the White House gating criteria. That is the Centers for Disease Control gating criteria. It also makes sense that our testing has been 100% prioritized on people that were symptomatic or working in the healthcare industry. And only recently, with the testing surge, was it expanded. And it wasn't expanded to anyone who wanted it willy-nilly. It was people that had been around COVID-19 or believed they had contracted COVID-19. So we'll have additional testing as necessary. We talked about where we're going to surge it, but that is likely the most important number that we could see is the decrease in terms of positive tests. That means a decrease in the number of people that are contracting a virus that is already widespread. I want to say in closing, just thank you so much to the people of Arizona. I showed a green light today, and it's a green light to continue to go in the right direction. We are clearly on the other side of this pandemic, and we will be focusing resources and supplies and care to those that need it most. And those are our population 65 and older with an underlying health condition. Arizonans have sacrificed much to get where we are today. And the fact that we're able to make these positive decisions safely and squarely within phase one is because of you. And I would ask for this continued responsible behavior, continued physical distancing, and all the fundamentals that you've practiced so well over the last several weeks. We'll continue to update you. Tomorrow, pools and gymnasiums open. Retail and dine-in is also open. Stay healthy. Let's return smarter and return stronger. Thank you, everyone.